have the good fortune of having a very close relationship with our county health department, who runs our school health services. So our school nurses and our health techs are employees of the Montgomery County Department of Health and Human Services. And we have a very, very close partnership when we think about health together.
So we're about more than halfway through the school year right now. What issues are you seeing?
So right now you're hearing us talk a lot in public spaces about opioid overdoses, which have been increasing in American youth. For the past few years, I'm doing a lot of cross collaborative work to address substance use and specifically fentanyl-related opioid overdoses in youth, because it's a fatal trend, an alarming one. Certainly, substance use in youth is a really, really important issue to consider in the larger context of how we take care of them and support them. So we're also, talking a lot and trying to make the connection to mental health and recognizing when kids may be struggling.
Can you talk a little bit about some of those school support programs that are available for students?
Yeah, so last year, one thing we did in our high schools was to add social workers to the team. And this year, we had already had comprehensive wellness centers in 5 different high schools, but we expanded services to the rest of the 19 comprehensive high schools to include dedicated mental health staff.
So let me ask you, how do you handle situations where maybe children and or their families really don't have access to good health care? What kind of services does the school system provide?
So one thing that we can be really proud of in Montgomery County is our comprehensive school-based health centers and school-based wellness centers, of which there are currently 14. This is a partnership with Montgomery County Department of Health and Human Services, and various community partners to be able to provide free medical care in schools for kids who may not be eligible for other types of public assistance. So the schools are really central, a central part of how Montgomery County serves populations who may not be eligible for other types of public medical assistance.
As this position evolves over the next year or two, or even looking down 5 to 10 years from now, what are you hoping to accomplish?
So I'm hoping to accomplish my main mission of thinking about health really impacts students' ability to be in their space and to be successful, and to make sure that health should not be a barrier to living your best life or showing up in school. So I feel like everybody should come out in support of what happens to kids in schools, but we don't always have those working relationships. We're really good at certain things in the medical community. We're focused on health outcomes. In the school, we're focused on educational outcomes, but for health outcomes to be great and for educational outcomes to be great, this really needs to be a community conversation and a partnership. So I would hope that having a person in this position is going to allow crosstalk and a more comprehensive community-based approach to child health.